the risks of behaviors? For example, if this woman was quarrelsome and
The
she's the surrogate
surrogate
mother, yes,
Uh-huh.
maybe she's diabetic, or maybe she's this kind of very active person. Is the baby
So
also
can
going to
that
inherit
influence
some
the baby's-
behaviors? Yes.
So there are certain aspects of the surrogates, especially health, the surrogates' health, which do influence, which do influence
Okay.
the life of the baby. That's for sure. These are usually health things. For example, if the surrogate drinks alcohol,
I drank it.
yes, if she drinks alcohol, and during this time when she's pregnant, she also is drinking, the effects of alcohol can go to the baby.
That is the
as well.
environment you were talking
The
about.
environment,
Very
yes,
good.
yes.
Yes.
Yeah. Or if the surrogate is having another illness like diabetes, or she for some reason gains a lot of weight, yes, we now know that can affect the baby as well.
Okay.
Yeah.
Okay.
But apart from that, anything which is genetically controlled cannot be transmitted into the baby.
Okay.
Yeah.
Thank you.
Yes.
How about single fathers and mothers? For example, if I'm single and I want to do that, is it acceptable?
Thank God I know you're not single. Well, these things we have to practice in the context of the society. The Bible is clear on that. Yes, I'm free to do anything, but not everything is beneficial. Yes, so we have to listen to the laws of the country. The laws of the country do not permit becoming a parent by choice as a single parent. The laws are, if I can summarize, I'm not a lawyer, but for example, the law does not permit single parenthood, for example, for lesbians or for, yes, all those form of what our culture accepts. We don't.
We don't accept it
So
medically.
if a woman shows up and says, you know what, I want to get out my eggs, fertilize it with whichever sperm you have in the sperm bank, and then put it in the womb of a surrogate. I mean, that will not be permissible. That will not be permissible by law, and I think by morals, it won't be acceptable, at least for us here in Africa and in Uganda especially.
Okay, we accept it or not. Doctor, what if a mother is, for example, she's overaged, about 45?
Yes.
She's infertile. She does not have the ability to produce eggs.
Yes.
And here she's in need of IVF treatment to conceive, or maybe through surrogacy. How best do you help such a mother?
Yeah, so now in this matter, I think the issue we'll have to find out is, can she carry her own pregnancy? That will be the thing. Because if she's already having the inability, she's not able to produce her own eggs, that means now you need donor eggs.
Oh,
yes, now you need donor eggs.
Donor eggs.
Now, in such a case, you would prefer that she carries the pregnancy, because at least that creates an opportunity for attachment.
The bond.
And, yes, the
surely.
bond, and for her to participate in the upbringing of in the process of having the baby. But of course, there are some people, they have for some reason, they have lost their uterus, and now they are of age, so they are not having eggs, and those do happen. Yeah, in such cases, you have no choice but to use donor eggs, and then you need to use a surrogate as well for them to have a baby. Now, this is scientifically possible, and if you look at the social situation, our marriages get blended by children.
True.
And if such a couple approaches you, to deny them the opportunity to have this treatment will be quite unfair.
True.
Yeah. But we are waiting for the legal pronunciations. In some countries, they don't allow this. They will not allow this. But I think they are not fair enough.
True.
They are not fair. In our situation, I hope such a thing will be allowed, because as long as you allow adoption,
yes.
This is almost similar.
Almost
but
similar.
in this case, it's better because the man's sperms will be used.
Okay.
Yeah.
Through the donor's egg.
Yes.
Okay.
Yeah.
Thank you so much, Doctor.